Now that cannabis is legal in Canada, more people are using it for health reasons. How effective is it, and what are some of the health risks associated with it? Joining me now to talk about it via Skype from Calgary is Professor Jacqueline Smith, Director of Mental Health and Wellness in the Faculty of Nursing at the University of Calgary. Jacqueline, welcome to BCN.
Thank you. Great to be with you today.
So what are some of the benefits of using cannabis for medical treatment? I know some people use it for pain relief. Are there other potential benefits?
Well, what I do want to say, cannabis has been around for a long time, but because it was an illegal product for so long, there was minimal research. So we are starting to do some research, but it is still in the early phase. What we do know that is cannabis now is being recommended for pain associated with palliative care. So those who are, again, palliative. Also for nausea and vomiting in relation to chemotherapy, for spasticity, for multiple sclerosis. And just recently, in the last couple of years, it's now being used for treatment-resistant epilepsy in children.
Wow. I have members of my family who are seniors who like to use it for their fibromyalgia and their osteoarthritis. Your thoughts?
Well, cannabis is a very complex compound, and there's lots of different cannabinoids associated with that. So I think the research right now is very, very interesting because they're starting to isolate some of those compounds. And I have heard in research that there is an anti-inflammatory property to it. My caution is, again, this is early research. And you have to have a really critical eye when you're looking at research, because some research, they do it with small participants, number of participants. Some research is not being replicated. We're not seeing random control trials as well, too. So I'm concerned there's a little bit of a panacea effect right now, and where cannabis is being recommended for everything under the sun. Now, I want to position myself as someone who sits on the fence. On a personal level, I can tell you that one of our daughters was treated for a cannabis use disorder. And, but also my father, who's passed away from cancer, used cannabis for pain control. So again, I think we have to be very cautious. I am a researcher. We did some research with students at the University of Calgary, and we do know that many young people are using cannabis, and they're saying that it's effective for their anxiety, for their depression, and for their sleep, and for their pain. And we don't deny the fact that people are experiencing positive effects, but what we're saying is that also alongside the positive is the potential for risk, because we don't know the long-term consequences of someone who's using a product over a long period that has not been thoroughly researched.
And I've heard students as well, they like to use cannabis and the cannabis oil when they're vaping and their vaping products. But let's talk more about the larger or more growing demographic, and you say it might be seniors?
Yes, we are seeing a rise in the senior population using cannabis. Again, caution, because when you look at some of the effects, the side effects of cannabis use, it can cause some coordination problems, some dizziness. So we do worry about seniors who are using cannabis and may be at risk for falls, not to insult any of their intelligence, but I think what's really important is that when you are seeing a healthcare practitioner, so we have physicians and nurse practitioners who can prescribe it. So when you're seeing them, you want to be sure that they are thorough in going over the side effects and the potential risks, the potential benefits, and looking at some of the contraindications as well for people who are wanting to use cannabis. And there are some, if there's a family history of psychoses or just substance use problems, that is a concern. And of course, very, very strong evidence with cannabis use with those who have a predisposition, again, towards psychoses or schizophrenia. That's very thorough research, and we know that people are at high risk of psychoses or schizophrenia as well if they have a family history of either of those.
So what is it in the cannabis itself, doctor, that provides pain relief? Is it the THC, the CBD?
That's a very, very good question, and one that we really emphasize now when we're educating our university students. A lot of people don't understand that cannabis is the two main components are THC and CBD. Now, THC is a psychoactive, mind altering substance, whereas CBD is non intoxicating. So, most of the research, I actually read a systematic review today in preparation for this interview, and it's 2020 January. And what they're saying is that most of the research now is favoring CBD as a potential substance that can help with things like we're talking about pain. There's some early research around anxiety as well, social anxiety. I did see research connected to PTSD and to sleep disorders that are associated with PTSD. So again, I'll caution, all of those studies that I just shared with you are early. So again, we have to be very careful when we're looking at the research. The ones that we talked about at the beginning for palliative pain, for spasticity, for the nausea and vomiting, and for the treatment-resistant epilepsy, solid research. But the others that we're talking about now, we have to be careful with.
When I talk to chefs about cooking, a lot of times they say, Hal, the best way to release the lycopenes in the tomatoes is when you cook them instead of eating them raw. And I thought that was interesting. Is it very similar when it comes to cannabis, that people actually smoke the cannabis as opposed to edibles to get the most bang for their buck, so to speak?
Well, that again, you're just bringing up some really great questions. So there's a difference between smoked and edible. One is the effect. So when you smoke or vape, typically you're starting to see an effect within 10 minutes that peaks at 30 minutes. With edibles, sometimes it takes up to 30 minutes to feel the high if you're using the THC, and then that sometimes takes up to 4 hours to peak. So the problem is those who are accustomed to getting that quick high from the smoked cannabis and are then trying the edible, they're, let's say, as an example, they'll eat a brownie and within 10 minutes, they're waiting for that high that they normally get from something that was smoked, and they'll eat another one and another one. So that is a concern. In fact, we are seeing data out of Colorado where there's increased visits to emergency now because of intoxicating effects. So basically overdosing on cannabis, and you would see things like psychoses, increased heart rate, paranoia, definitely concerning symptoms. And again, the concern with the edibles is that now we're dealing with children, with pets, and the caution is if we're making an informed decision as adults to use it, we have to be very, very careful with our children who may be curious, or with our pets who just may eat something that fell on the floor. So
yeah, I'm wondering how dangerous that would be for, like you said, your pet or your child, a baby, a toddler, to get a hold of some of the edibles. How toxic that may actually be, how dangerous.
Well, and again, a good point. It can absolutely be dangerous. When we're talking about THC, we're talking about a psychoactive, mind-altering substance. And for pets as well, we're seeing more research where vets are seeing animals coming in with intoxication as well from cannabis products. So I think what's really important to bring out as well is that there's different concentrations of THC in different products. So they can have a level of up to 99% THC, whereas you can get as low as 4 and 5%. On average, we're looking between 30 and 40 concentration levels of THC. So it's, again, I hope what's coming across here is that you have to be a very informed consumer. You have to be very, very careful about the research. I can tell you that there's a lot of profiteering going on, and that panacea effect, there's people making a lot of money on products, topical as an example, creams for your skin, there's no strong evidence to suggest that these products are actually effective, but people are paying a lot of money for these products. Is there potential for research to prove that they're helpful? Absolutely. But My line is that I think we're flying a plane as we're building it. So we have to be very careful, and you have to know that you can trust your healthcare practitioner. Again, that they're doing all the screening questions, they're giving you the risks and the benefits. There's no really standardized um, dosaging right now as well too. So what they're saying is you want to start low and you want to go slow. And for those who maybe are used to smoking cannabis and are switching over to the edibles, they have to realize they are not going to get the effect as immediate as they would with the inhaled. So there's so many different variables to consider, again, if you're making the decision to use.
One of the stories we had on Bridge City News last week was down in the United States, how people are using CBD oil on their pets, like their dogs, saying how it's helping with the pain and their suffering. What are your thoughts on that, using it on our pets?
I think, again, in all areas of cannabis research, it's new. I do research with humans, so I just know that that's another area that we have to be very cautious with. And again, I think there's a potential for profiteering from promoting a substance that's effective when in fact it hasn't been thoroughly researched.
Some say cannabis is not addictive at all, but others say it really can be. What does the science say?
The science says there's absolutely a diagnosis for a cannabis use disorder, and it's found in the diagnostic manual of mental health disorders. And absolutely. And people, I've actually seen the comparison between coming off of cannabis as coming off cigarettes. So there is that withdrawal as well. There's definitely the tolerance as well, where people are starting with smaller concentrations and having to go higher with THC as well, toxic levels to get the benefits. So all the same symptoms of other substance use disorders, and I can definitely tell you. I'm also a clinician who has worked in the area of addiction and mental health, and I've absolutely seen cannabis use disorder amongst youth. And youth is an area that we need to be very, very cautious with, because we know that the brain continues to develop up to the age of 25, even 26. So while the brain is still developing, our youth are at a greater risk of problematic use because of their developing brain. And the research says that the earlier you start and the more frequent you use, the more risk you are of creating of cannabis use disorder or problematic cannabis use. So I think a lot of research, especially from the Canadian Center of Substance Abuse, they're putting out a lot of literature around caution with young people. And again, we know they're using, in fact, Canadian youth are among the top youth in the world who are smoking cannabis. So we're paying particular attention right now to that.
Are there any potential problems if you consume cannabis edibles along with alcohol or maybe some medications?
Absolutely. We are definitely seeing, if you're consuming alcohol and cannabis, you can potentiate the effect of those two. We do know that we've done a lot of work around impaired driving with alcohol. We're also now having to move forward and look at impairment from cannabis use. And I think we're having to re-educate our young people, because what we do know is the fact that the government has, Health Canada has legalized cannabis. We know now that the perceived risk for young people is going down, and we're seeing a reciprocal effect with that too. So as the perceived risk goes down, use is going up. So the message to a lot of young people is, well, it's legalized, it can't be that bad. So we're really having to do the education again around the CBD, the THC, around the developing brain as well too. And what I do know, that our young people are smart and they want to know what the science is saying. So I think we need to teach our young people to make informed decisions. And I think, again, there's a lot of really good research. Canada's lower risk cannabis use guidelines. It's a harm reduction approach. But again, it's giving all the information. It's saying if you choose to use, these are the things that you should be aware of. So again, giving people the respect and dignity to make the decision and to make it in an informed way as well.
And another thing, when we were talking about some of the long-term detriments or the effects of using cannabis, when you go to the Canada-US border and you want to enter the United States, they ask, have you ever had cannabis? Have you ever smoked pot? If you say yes, good luck getting into the United States right now. That's another danger.
It's true. It's true. I mean, Canada has legalized it federally, and you're seeing across many states in the U.S. they have legalized it in some states, but they have not across the country. So they're protecting their people. I appreciate that.
Professor Jacqueline Smith, Director of Mental Health and Wellness in the Faculty of Nursing at the University of Calgary. Thanks for your time today.
You bet. Thank you for having me.
On behalf of all of us here at Bridge City News, I'm Hal Roberts. God bless, and thanks so much for watching.